histology, we'll talk about the upper and lower compartments. We'll talk about the articular disc histology, and we'll talk about the capsule, the histology of the capsule. The head of the condyle has 4 layers. We have the most superficial fibrous layer. Underneath it, we have a cellular zone in adults or a proliferation zone in before adulthood. The third layer underneath is a fibrous layer with cartilage-like cells, so we call it a fibrocartilaginous layer. We have underneath a calcified cartilage layer directly covering the bone. The articular surface of the mandibular fossa will be very similar, but it's only thinner in the upper portion. Mandibular fossa, or what we call pterygomandibular or craniomandibular fossa, it will be thinner in cross-section. Here is the lower articular surface. This is the synovial in between, underneath the articular disc, the lower synovial cavity. Underneath, we have an articular zone, a very thin proliferative zone in adults, fibrocartilaginous zone with multiple fibroblast-like cells and cartilaginous or chondrocyte-like cells. And also we have the calcified cartilage layer. Beneath the articular disc, we have beneath the cell-rich zone, what we call a cell-rich zone, we have here that replenishes this zone. It replenishes the cells in, or it's a source of cells in the adjacent layers. Beneath it, we find a fibrous layer with cartilage-like and fibrocartilage and cartilage-like cells. We call it fibrocartilaginous, we have said. And underneath, immediately covering the bone, we have thin layer of calcified cartilage. You can distinguish it by bone in different staining. The calcified cartilage here is a remnant of the secondary condylar cartilage that we have studied in development. The articular surface covering the mandibular, here, the mandibular fossa of the temporal bone is similar to that of the condyle, while generally thinner, and it thickens as we pass over the articular eminence. So it is thin in the fossa and thicker at the articular eminence. We show some crimping that we will talk about here in the superficial collagen fibers. Let's go to the articular disc. The articular disc is composed of dense collagen fibrous tissue. It is described as intra-articular between the articular surfaces, so we call it intra-articular discs. We have a matrix composed of fibers that run in the center and in the extremities in different directions. The center part of the articular disc, the fibers run anterior-posterior direction. So we have a regular direction of the fibers, collagenous fibers, while in the anterior end and the posterior ends, the extremities, we have multiple directions, mediolateral, superior, inferior directions as well. So the fibers run at random, more randomized direction. We see more convoluted appearance anteriorly and posteriorly, as we can see that most of the collagen fibers are convoluted. Here we see in a sagittal section from the articular disc, we have the interference. This is an interference microscopy. We see this crimping arrangement of the fibers. We call it crimps under dark and light bands. Waviness or crimps of the fibers. The collagen fibers have a crimped nature. This can be shown in the articular surface, in the superficial collagen layer of the articular surface, and also in the intra-articular disc of the temporomandibular joint. These crimps that you can see are important for biomechanical properties of the connective tissue. It is adapted to resist compressive and loading, and circumferential collagen fibers will have adaptation to the tensional loads. Okay. As a chemical composition, you can see that mostly 80%. The articular disc, normally 80% of it is composed of water, but the other components are fibrous. The fibrous is 80% collagen type 1. Although we can see some traces of collagen, other types of collagen recorded, we can see also small quantities of elastin fibers. We can see in the disc, we have variation amounts in the disc, anterior, posterior, or middle bands. We see also that some traces of dermatan sulfate and chondroitin sulfate, hyaluron, and heparin sulfates. All of these ground substances have a anionic charge. Because of it, it will absorb water, these aminoglycans. Because of them, they will absorb water and adapt the intra-articular disc to resist compressive loading also. So it's a cushioning effect, and it composes 5% of dry weight. We see that the elastin fibers, for example, the collagen is the main component. Elastin fibers will decrease with age. They are much at childhood age and will decrease as the age of the individual will have less elastin fibers. The ground section, the fibronectin and transectin also are located in the articular disc. According to cells in the intra-articular disc seem to be more numerous at time of birth. Okay, because they become more sparsely distributed in the adult. The cells show an outline between flattened shape and fibroblast-like cells, and more rounded shape, the chondrocyte-like cells. The more rounded cells, they possess considerable amounts of cytoplasm and kinetics. We don't understand much of the ultrastructure in these cells, but we say that these cells have moderate amount of endoplasmic reticulum and intermediate filaments. The cell membrane is closely opposed to collagen fibrils of the extracellular matrix. Under fluorescent microscope, we can see also the differences between fibroblasts and fibrocytes. Okay, we can see the flat surfaces and the fibrocytes that are more inside in active form. Collagen fibers also can be seen inside of these fibroblasts or fibrocytes. You can see collagen bundles or fibrils of collagen that we have much talked about. Let's see if I have a picture. Not really, but what I wanted to say is that here, the fibrocartilaginous areas inside the disc, we have rounded appearance of cells. We will have reminiscent of cartilage in lacunae, the fibrocytes, and we'll have interfering between the cells and the lacunae that can be stained in different stains. Okay, the true cartilage cells, a characteristic feature of true cartilage cells is the presence of pericellular matrix, what we call a pericellular matrix that intervene between the cell membrane and the type 2 collagen. Okay, these type 2 collagen fibrils in the extracellular matrix and the cell membrane, we have a pericellular matrix. It contains microfilaments material that is delineated by a pericellular capsule. Most research shows that we don't have a pericellular capsule, a capsule around the cells. We have only what is important of these cells are the processes. Fibrocartilaginous cells have high processes, which makes passage of nutrients, passage of fluids from the peripheral blood vessels and the outside surface of the disc, because it is highly vascular, towards the center part of the disc, which is avascular. Also, the cartilage-like cells, if you want to say about the cartilage, they do not have a pericellular matrix. Mostly, in older discs, we have even no less pericellular matrix. As we age, we have more cartilage-like cells, and we have less capsular pericellular matrix. Let's go back here about fibrocytes and fibroblasts. We have mainly associated in the secretion of this extracellular matrix. We have reasonably active fibroblasts and less active or slow fibrocytes, slow turnover rate. Nutrition, we have said that the bulk or the center part is avascular. We have nutrition from synovial fluid. This is number one. Number two, blood vessels in the peripheries of the disc, because the peripheries are highly vascular. Number three, the superior lamella of the posterior part. Here we have numerous vascular spaces. And we have the also the part here, it is highly vascular, that is between the superior and inferior. Changes in blood flow with the jaw movement is thought to be a mechanism of proprioception. Okay, the jaw movement with the blood flow. Let's move finally to the synovial membrane that lines the inner surface of the fibrous capsule, the inner surface of the fibrous capsule of the temporomandibular joint, and the margins of the intra-articular disc. Only the margins, while it does not cover, this is very important, the articular surfaces. The articular surfaces are only covered by fibrous tissue and not by synovial membrane. It is obviously, anyway, the articular surfaces are rapidly worn. We have rapid fibrous tissue wearing. So the synovial fluid, it consists of a layer of flattened endothelial-like cells that rest on a layer of vascular layer. We call this superficial layer out of two types, macrophage-like cells and fibroblast-like cells. The macrophages are phagocytic, and the fibroblast-like cells for the extracellular matrix synthesis. The synovial membrane, it shows high metabolic activity and high powers of regeneration also. Also, it has many folds at rest. These folds flattening out during movement of the jaw. So at rest we have high folds, and once we have movement, we will have more flattening. With age, the number and the size of the projections that are here will increase to supply more of the discal tissue. Synovial fluid that is secreted by the synovial membrane and occupies the upper and lower cavities. Mostly the fluid is 1 ml in the inferior compartment and a little more in the superior cavity, synovial cavity. It serves for lubrication. It serves for, we have some components here that have lubrication of the joint. We have important also proteoglycans serving for lubrication, hyaluronan and fibronectin. Also, normal synovial fluid that is here also contains some pro-inflammatory cells. Okay, cytokines, interleukins. We have at rest the hydrostatic pressure at rest. I don't know where is it mentioned here. The hydrostatic pressure at rest is subatmospheric, and it greatly elevates during mastication. Let's talk about the developing condyle. This is the last part. We have secondary condylar cartilage that appears at, it is called a primary cartilage. It appears at 10 weeks in utero, initially, at 10 weeks in utero. Remember that we have said remains a zone of proliferating cartilage until adolescence. Like the adult mandibular condyle, the child is lined by fibrous tissue, fibrous articular tissue, and beneath it we have a proliferative layer of undifferentiated cells that shows more activity. They are highly active. Cells here in the proliferative layer give rise to fibroblast-like cells that will differentiate into chondrocytes, which will then form secondary condylar cartilage. Chiefly, the chondrocytes in the deep part here will synthesize types of collagen, and extracellular matrix will undergo endochondral ossification. In brief, the endochondral ossification process, it is mineralization of the cartilage matrix and subsequent apoptosis of the hypertrophic chondrocytes that are present here. The calcified part of the calcified cartilage is resorbed by multinucleated osteoclasts that are found beneath. Osteoclast that subsequently bone-forming cells, osteoblast will deposit woven bone. The woven bone will later on be more calcified or more mature, will form more mature calcified bone. Okay, so remodeling to produce mature bone in this area of endochondral ossification. We have said that unlike the chondrocytes in typical bone or typical plates, the chondrocytes here we are not aligned. They are not aligned in lines or columns, and they do not secrete very much intercellular matrix. Possibly the growth of the mandible in young child is not lined by compact bone. So we say that the condyle in the young child, where you'll find it in your practical module, the condyle of young child is not lined by compact bone as you see in the adult condyle. Thank you so much.